Let me ask you something here about integrity. And when I talk about, or when we think about the word integrity in nursing school, are we just thinking about exams, or are we just thinking about grades, passing school? Or are we thinking about the kind of nurse that we're wanting to become when nobody is watching? The kind of nurse that you and I are when nobody is watching? Is that what we're thinking really is integrity? Because in nursing school, it's not something that, is really discussed a lot of times. You understand? We talk about content in nursing school, but they don't really talk about judgment, and that is a part of integrity, and both of them is equally important. Integrity is equally important as your grade. So today we're going to talk a little bit about integrity in nursing education, and this is not to shame anybody, it's not to call out anybody, because really and truly, when you look at the nursing profession, this is a profession where we're saving lives, and people's lives depend on our decisions, and we want persons to enter the profession that has integrity. And I think we need to be honest about something here. When pressure reaches in a nursing school, yes, the exams out there, they're very tough. Nursing school is very tough. The expectations are high. Sometimes you're feeling so overwhelmed. That pressure is going to put you to the test, and that's where integrity comes in. Your integrity is going to be tested. When we think about integrity, a lot of persons immediately think about what? Cheating on the test, because yes, you want to pass, but integrity is bigger than that. It is what you, like, just think of it. Doing the work even when no one is checking. You want to make sure you're asking questions when, you don't fully understand it, taking responsibility for the things that you don't know. You want to make sure that you're understanding that if you make take some form of shortcut in learning later on in the patient's care, it is going to show up. Because in nursing, if you avoid learning something today, see it in the patient's outcome tomorrow. That's just how it is. Because when you have a patient that comes in and the patient is confused, the patient is deteriorating, the vital signs is all over the place, in that moment, you don't have your cell phone, you don't have a study guide, you don't have multiple choice questions, you don't have anybody there to tell you that this is what you need to do. It's your assessment and how you go about with acting. So that's why integrity, it matters, not because of rules, but because nursing is real-time decision making. That's what you're doing. You do take shortcuts in learning. It doesn't disappear after graduation. It shows, especially when you're under a lot of pressure. So especially for us in nursing school, we know that nursing school is very intense. We know that people out there are working, we're parenting, we're surviving, we're sacrificing, we're under a lot of pressure. But even under pressure, we have a responsibility to make sure that we're asking ourselves what kind of nurses we're wanting to be, what kind of nurse I'm building. Because every nurse eventually will leave nursing school, and that's where accountability increases. Stop when you leave nursing school. So the nurse that struggles the most in practice are not always the ones who struggle academically. Sometimes it's the one who never fully built the confidence in what they know are the ones that actually struggled a lot. So integrity, it builds your confidence because you don't have to second guess the things that you learn. Own it. So when I talk about integrity, I'm not talking about perfection here. I'm talking about intention. So are you learning to pass just the course or the program, or are you learning so you can care for someone's mother, their father, their child, their loved one a little bit safer? Because that's what real standard of nursing holds us to. They want us to make sure that we're providing safe care. The goal is not for us to be perfect, but it's for us to be prepared to take care of those patients. So once you step out there as a new grad, new nurse, you're supposed to have the basic competency to take care of those patients. So if this message do resonates with you, I would love for you to go ahead and share it with a nursing student, a new nurse, because this is a conversation that we need to have, and it's not something about any blaming. We're trying to make sure that we're building better nurses. We want to build up each other, because in nursing, integrity is not optional. It's a part of patient safety, because in any given day, you and I can be a patient, and we're just hoping that that nurse that is standing over us have some form of integrity. So we have to start from early, because we don't know who our nurse is gonna be, and so we have to start from early, and we have to start talking about it so we can bring back that integrity in nursing. We want those kind of nurses back in nursing, because it's not all about just going through nursing school and passing. It's the kind of nurse that is out there on safe nurses. That's what we want out there. Go ahead and leave your thoughts regarding integrity in nursing. Do you think it is still emphasized in nursing school? school a lot, or do you think that it is something that, you know, we kind of forget and just want to just pass the nursing program and just real world? What is your take on it? Bell on and be a part of the family here at Think Nursing, and I'll see you in the next video. Bye.